Value versus cost in healthcare. Can we have it better for less? Well, that's the theme of the INSEAD Alumni Healthcare Summit here in London, and we're about to put that question to Professor Gillian Leng. She's the Deputy Chief Executive of NICE, which is the National Institution for Health and Clinical Excellence. It's part of the NHS.
That's correct, yes.
Long title, but welcome to INSEAD Knowledge.
My pleasure.
NICE was established about a dozen years ago to ensure that patients receive appropriate care at the local level. Why was that necessary?
The aim of the establishment of NICE back in 1999 was probably to do two main things. One was to standardise care across our health service. There was a recognition that people were, say, accessing new drugs in some parts of the country and not in other parts of the country, and nobody felt that was appropriate. So one of NICE's roles was to provide standard advice, national advice for our National Health Service to prevent that happening. And the other aspect of the work that NICE was doing was to evaluate new technologies, and by determining what was cost effective, what was good value for money, to drive uptake of those new products as well.
And so what is your specific relationship to the NHS? You're part of it, but the NHS seems to be this labyrinthian sort of organization.
The NHS is certainly a large organization. It employs a huge number of people. Our relationship is to provide advice and guidance for the health service, and we do that in a number of ways. We look at new drugs, we look at new diagnostic tests, we look at new technologies, we look at new interventional procedures, things that surgeons usually use, such as new innovative ways of treating varicose veins. And we also provide comprehensive guidelines on a particular disease or condition, which are very broad recommendations about large aspects of care, such as how you manage depression, antenatal care. We have a whole suite of guidance for our health service on maternity services.
What kinds of challenges are facing you today? I'm sure there are a lot, so just what are your top three?
Challenges for NICE are the ongoing pressure of healthcare funding. We all are aware throughout the world of the new and increasing number of technologies that are available to the health service. So it's part of the work that we've done for years, but it's increasing. It's managing the challenge between new technologies and the funding. For NICE, there are also challenges that relate to expanding the type of work that we've done. We have focused a lot on healthcare. From next year, we are also going to use the same type of approach to look at more supportive care services. We call it social care. So as well as the direct healthcare costs, how are we going to move into and assess the broader care costs as well that the country requires? And there's also the methodology that we need to use to assess new drugs. That's a challenge that we know we need to look at over the forthcoming year. There's a desire that NICE takes into account more explicitly some factors, such as how innovative a new drug might be, whether the severity of the disease should have more weighting, and the burden of disease on society. So we need to also have a focus on the methodology and look at how those factors are taken into account.
Now, you're a visiting professor at King's College in public health. Mm-hmm. How would you describe kind of the current situation of public health, not specifically in the UK, but kind of maybe within Europe? And then how do you see the outlook for healthcare maybe in the next 3 to 5 years?
Public health issues in the UK are largely focused on improving the health perhaps of the least well off. One of the issues that we know for more developed countries is that there are inequalities in health, and despite increased longevity across the population, we still have big differences. We see in parts of the UK that people living just a mile down the road will be living 5, 6, 7 years longer than people in the community not that far away. In terms of the challenges across the board for healthcare and public health, there's the ongoing problem of spiralling costs that we need to contend with, that NICE addresses through its cost effectiveness work, but also the demographic changes that we see, an increasing elderly population, and that is a good thing. But what we are seeing also is, towards the end of life, patients that have an increasing range of conditions. So we used to talk about comorbidities, now we talk about multimorbidities. There's a significant proportion of patients in their 80s that have 8 conditions or more, and the complexity of managing those conditions is a challenge that I think a number of countries will recognise, and it's something NICE is actively looking at.
So looking 3 to 5 years down the road, you see this sort of multi-morbidity management as the main focus?
I think it's an important focus. It's an important focus for the evidence base and the work that NICE does to assess it. Research studies tend to not take patients who are very elderly, and it doesn't look at people with more than one condition. A nicer, clean population, if you like. So part of the work NICE has to do when we make our recommendations is to bear in mind that actually the people that the guidance might apply to have more than one condition. So that's one challenge, but there's also a challenge for the health care systems in general, in that a lot of countries have gone down the road of having specialist doctors, particularly doctors, even super specialist doctors. And when you've got patients with multiple conditions, it's very likely, certainly easy, that the overall care for the patient is lost, and I think we're beginning to see more generalist physicians developing, and a more general approach to holistic care for patients.
Well, thank you very much for being with us today on INSEAD Knowledge.
My pleasure, thank you.